This is tracheostomy suctioning. Now, there's not much different, okay, between nasotracheal suctioning and endotracheal suctioning. Okay, the only difference, of course, is the tracheostomy tube, and because, of course, the tube is much shorter, I will not insert it as deeply. If my patient's on the ventilator in the unit, okay, then, of course, once again, before I suction, I'll need to look at their heart rate, their blood pressure, their saturation, and their ventilator settings to get a baseline. Okay? If they're out on the floor, that's fine. They don't have those things. I would want to auscultate again, just like I did on the other one, and make sure the patient needs it. Okay? Check their color. Now, in this case, I'm using a sterile suction. We've been through this before. I would simply attach it, okay, being sterile as I can, and I would run it in. Now, remember now, it's not as deep, so I'd only go in a few inches, put the suction on, come out, and put the oxygen on the patient if they're on the floor. If they're in the intensive care unit, once again, heart rate, blood pressure, saturation, and their ventilator settings. Disconnect from the ventilator. I would run the patient in, suction, okay. Suction on the way out, never taking longer than 15 seconds, wrap it up, reattach the patient to the ventilator, immediately checking their heart rate, their saturation, their blood pressure, and their vent settings to make they've come back to normal. If they've not come back to normal, not to suction again until they do. Okay, I may need to hit the give more oxygen button on the ventilator if they're on the ventilator. And that's the only difference between tracheostomy suction. I can do it inline suction the same way. Use the inline catheter, run it in, but I'm always in the intensive care unit, and they're on a ventilator, always. Heart rate, blood pressure, saturation, and their ventilator settings, particularly the PIP and the volume. Always check those things first, and immediately after finishing suctioning and reattach the patient, check them again. If their heart rate's going down, I may need to get my man resuscitator and bag the patient, okay, or hit the oxygen, give them more oxygen. Okay. Saturation, when they desaturate, that's what it means. Their saturation's fallen. Once again, they need to get oxygen to bring that back up. Okay? All right. That's it. Thank you.